Hello and welcome to today's episode on Life Saving Aid. Today we are going to be looking at the accidental swallowing of kerosene in children and what we can do to help reduce complication and increase their chances at survival. It's important to know that the accidental swallowing of kerosene in children is a medical emergency, and this is because when kerosene is mistakenly aspirated into the lungs, it can cause a chemical burns to the lungs called chemical pneumonitis. This chemical pneumonitis is capable of causing death if not properly handled. Kerosene is also capable of affecting other organs in the body. This is why taking the right action is very, very important. Also, when it comes to the accidental swallowing of kerosene in children, preventing it from happening is usually your best option. And how can we prevent this from happening? Number one, ensure that kerosene is not stored in transparent containers like this. In this situation, the chances that a child can pick this up and mistake it for water to drink is high. Number two, ensure that kerosene or any other harmful liquid is stored safely away from the reach of children. Children should not have easy access to liquids like this. So it means that in your kitchen, it should be high up in your kitchen cabinet. When a child accidentally drinks kerosene, what do we do in order to help reduce complication and increase their chances of survival? First and foremost, you remove the child from the source of this kerosene. Number two, take off the clothing of the child, because most times when a child drinks kerosene, they also spill it on their body. And the inhalation of kerosene is capable of causing injury to the lungs. Number three, you move the child to a source of fresh air while the child is allowed to rest in a sitting position or in an upright position. Four, please and please quickly make your way to the hospital. If you're in an environment where emergency medical services are readily available, activate emergency medical services and let the child be taken to the hospital as soon as possible. Please and please, when transporting the child to the hospital, ensure this is done with the child in an upright position or in a sitting position. This is because we don't want the child to lie down and then the chances of vomiting becomes increased. And when a child vomits, in the case of the accidental swallowing of kerosene, the chances of aspiration is high. And when kerosene is aspirated into the lungs, it causes a chemical burn called chemical pneumonitis. It's a feared complication that is capable of causing death in children. This is why we do not induce vomiting. We do not give anything by mouth. There are a lot of cases and circumstances whereby people advocate that you give more water, you give milk, you give palm oil, or you give herbal concoction. Please and please, when a child accidentally drinks kerosene, do not give anything. The reason why people advocate that they should give milk or more water or herbal concoction is because of a false belief that it will neutralize the kerosene or dilute the kerosene. Hope you know that water and kerosene don't mix. So with other liquid like the milk and the herbal concoction. So when you give these things, what you are doing is to increase the chances at which this child will throw up. And when this happens, you are increasing the chances of the child aspirating, thereby causing that feared complication we are afraid of, which is chemical pneumonitis. So it's important we state that when a child mistakenly drinks kerosene, a good number of them might not have any symptom. It doesn't mean that all is well. Still make your way to the hospital. For those who come down with symptoms, it depends on which of the system have been affected. Take, for example, if it is the respiratory system, whereby probably you went to induce vomiting and the child aspirated that kerosene, the child can start presenting with coughing, difficulty with breathing, fever, bluish discoloration of the mouth or the hands. If it's swallowing into the stomach, some children might present with abdominal symptoms, things like vomiting, abdominal pain. And then if it's in a situation whereby it's been absorbed into the brain, some children can present with seizures, convulsions. Some children can actually become unconscious. So depending on what you are seeing before you get to the hospital, in a situation whereby the child stops breathing, please and please, that's not when you are saying you are carrying the child in an upright position. When the child stops breathing or child becomes unconscious, unresponsive, what do? At that point in time, you activate CPR. I hope this video helps someone out there. Please share this video so that together we can help save more lives. And also we start advocating for the right actions to be taken. Please and please do not induce vomiting. Do not go about giving milk, give water or anything. Do not give anything by mouth. Okay? Stay safe out there.